of mental disorders should limit their caffeine intake as well. In fact, I know several psychiatrists who recommend that their patients do not have caffeinated beverages. So you have to be very careful when you're talking about taking other things while you're taking these medications. And speaking of medications, I think that any medication you take, there's going to be some sort of side effects. If someone starts having really terrible side effects from their medication, what should they do?
Well, I guess that you would first start with asking your doctor when he or she prescribes the medication, what should I look for and which of these are going to be serious and which of them are not. What are the things that I need to call you immediately if they happen? Also, you want to make sure that you talk to your doctor or your nurse. Most of the doctor's offices are going to have somebody that you can call if there's an emergency. I caution people not to just stop their medications. There are many medications, both in the psychotropic realm and in the just general medical realm, that just stopping them without a doctor helping you can be fairly dangerous. So I would advise anybody who has terrible side effects to talk to their doctor as soon as they need to, but also to have kind of researched with the doctor or the nurse beforehand what they should be looking for and which are going to be the serious ones and which ones won't.
Another question that people ask is about these natural or herbal supplements that you can get in at the drugstore or at vitamin places. How do you react when someone asks you about taking something like that for an affective disorder or mood disorder?
Please, guys, let's remember that natural is not safe. There are many things that occur in nature that are poisonous to us. So I would say, if that's something that you want to think about, there are lots of people who are interested in being more natural. Talk to the doctor. There are doctors out there who, all of our doctors are going to know which ones will be helpful to us and which ones won't. There are studies on some. The FDA manages some. The FDA does not manage every herbal supplement, so it's going to be very important that you talk to the doctor about which ones might be safe and which ones won't.
I want to go back just for a moment to talk about, when we spoke a minute ago about suicidal ideation, not everybody that's suicidal is going to tell you that they're suicidal. There are some warning signs. I can think of a couple, maybe you can think of some. One is particularly if a loved one says things like, look, I want you to have all of my clothes. I don't really need them anymore. Or if anything should happen to me, I want you to take my car. If they start talking in terms like that, or, sometimes I think I'd just be better off dead. This doesn't necessarily mean that they're going to go out and kill themselves, but those are warning signs. Can you think of some more that...
The irony of the one that I'm about to say is that a lot of times once people start treatment for depression, what we see is that a person who hasn't had very much energy at all will become more energetic. And then they might start shying away from their loved ones, trying to tie up loose ends. Joyce did comment about the possibility of giving away their belongings. Those are all things that you want to take pretty seriously and begin to delve deeper. And certainly, get more resources on board if you start seeing some things like that.
We want to thank all of you for joining us tonight, and please pay particular attention to the list of resources that we have that's going to come up on your screen in a few minutes. Thank you so much for joining us, and good night.